Okay, so today we discuss tooth structure in details. So, in general, we have the crown of the tooth and the root of the tooth. Between the crown and the root, we have the cervix or the neck. And we have the clinical neck, which is visible part here, and the anatomical neck. It is the boundary between the enamel and cementum. So in tooth we have the pulp, which fills the pulp chamber inside the tooth, dentin, which surrounds pulp and makes up to 80% of all the volume of the tooth. Dentin is covered with enamel in the crown region and with the cementum in the root part of the tooth. The root of the tooth is attached to the alveolar bone with the help of periodontal ligament, which has a lot of collagen fibers which make thick bundles. The cells and nerves and blood vessels enter the root canal and pulp chamber through the apical foramen, the hole at the top of the root. Teeth have three specialized hard tissues: enamel, dentin, and cementum. Enamel is a hard but very brittle. It means that it can break easily. It is thin, translucent layer of acellular mineralized tissue. Acellular means that it has no cells in mature tooth, and it covers the crown of the tooth. Dentin is filling the most of the volume of the tooth, and it has the unique composition with tubules inside of it, and it is covered with enamel and cementum. Cementum is thin pale yellowish layer which resembles bone tissue because it actually is the type of bone tissue. If we look at the radiographic picture, the harder tissue is, the more light it looks. So because enamel is the most hard tissue, it looks the most whitish here. Dentin is softer than enamel, so it looks more grayish, and cementum is softer than dentin, so it also looks darker. And the most soft part of the tooth is the inner pulp, which fills the pulp chamber and root canals, so it looks the more dark in radiographic pictures. So we will start with the enamel. Enamel is the hardest substance in the body. It is the tissue which was produced by cells, enameloblasts, but when they finished production of enamel, they had died with apoptosis, and mature enamel has no cells. Enamel is hard but brittle, so it can easily crack, but its structural and functional unit, enamel rod or enamel prism, has specific S-shaped structure which prevents cracking of enamel. Enamel consists mostly of mineralized substance, up to 98% of calcium hydroxyapatite crystals, and other 2% of components are water and some organic substances, most of which are proteins such as enamelins, also glycoproteins, and etc. Enamel is permeable. Its degree of permeability is lower than in dentin or in cementum or in pulp, but still it is permeable for some solvents, so it can be demineralized and remineralized. Demineralization means removement of minerals from the structure of enamel, and remineralization means return of calcium ions into the structure of enamel. And these two processes happen via diffusion of ions both from the outside with the help of saliva and from inside through the dentinal tubules and odontoblasts processes. The thickness of enamel varies. The most thick part of enamel is at the tip of the tooth in the cusp area, and it is thinner closer to the neck region. And also the hardness is maximal on the cusps and minimal is near the neck. And also the more enamel is mineralized, the more transparent, translucent it looks. So the structural and functional unit of enamel is the enamel rod or prism that spans the full thickness of the enamel layer from the dentin-enamel junction to the surface of the enamel. Enamel rod consists of crystals of hydroxyapatite. So, enamel rod, if we make a cross-section of enamel rods, we will see that enamel rod has the keyhole shape on the cross-section with the head more rounded in shape and the tail. The tails of enamel rods are located between the heads of adjacent enamel rods. Both heads and tails contain crystals of hydroxyapatite. In head regions, crystals of hydroxyapatite go along the long axis of the rod longitudinally, and in tail regions, these crystals become more orthogonally oriented towards the long axis of the rod. The substance between the enamel rod is called inter-rod space or interprismatic substance. It also consists of crystals of hydroxyapatite. So in this microscope picture, the scanning electron microscope picture, you can see enamel rods. They consist of crystals of hydroxyapatite elongated structures, and between the rods we have inter-rod space, which also consists of enamel rods. Of crystals of hydroxyapatite. In this scanning electron microscope picture, we see also the rods, which consist of crystals, and inter-rod spaces, where crystals are oriented at some angle towards the crystals in the rod region. So here we can see the orientation of the crystals in the rod, and here orientation of the crystals in the inter-rod space. So enamel rods have the S shape. They span from dentin-enamel junction to the surface of the tooth, and this shape prevents cracking of the enamel. So here in this picture you can see the border between the dentin, which is below, and the enamel. And in enamel we have this S-shape structure of running enamel rods. And here you can see the difference in the shape of enamel rod in different regions of the crown of the tooth. Enamel rod is the substance which was produced by ameloblasts during amelogenesis. So, when ameloblasts had their TOMS processes, they could produce hydroxyapatite crystals which made long enamel rods. And in the young enamel, we see these enamel rods, which consist of elongated crystals. Here in this slide you can see the description of the major proteins which can be found in enamel. They are amelogenins, ameloblastins, enamelins, and taftalins. Most of these proteins are produced only during development of enamel, and then these proteins are removed from enamel during its mineralization, and only enamelins and tuftelins remain in the mature enamel, but they comprise up to 1–2% of the volume of enamel. Most of the enamel is the mineralized substance, hydroxyapatite crystals. So, as you remember, during amelogenesis, the ameloblast first had no Tomes process and produced the first aprismatic layer of enamel, which is the most close layer to the dentin. Next, they had their Tomes process, and they produced the most thick layer of enamel, the enamel which contain rods. So it will be the second layer of enamel. And finally, they lost their Tomes process and produced the most surface layer of enamel. It is also aprismatic enamel. So finally, we will have three layers of enamel: innermost aprismatic, then prismatic, the layer which contains enamel rods, and the outermost aprismatic, once again, layer. In the enamel, we can see the cross striations. These are alternating light and dark bands. They go parallel to the enamel surface and orthogonal to the length of enamel rods. So this black arrow represents the direction of rods, and here you can see small cross striations. These are cross striations of enamel rods. They represent daily rhythm of production and mineralization of the enamel by ameloblasts during the formation of the enamel rods. Also, in the enamel, we can see the so-called bands of Hunter-Schröger. Here you can see them. They are also alternating more dark and more light lines, which go radially from the dentin-enamel junction to the surface of the enamel. These are actually the optical phenomenon due to the shape of the rods, because the rods are S-shaped. When we make the cut of them, in some areas the rod will be sected longitudinally, in some areas cross-section. So finally we will have the alternating cross-sections of enamel rods and longitudinal sections. All of this because of the shape of the enamel rod. So the areas which contain cross-sections will look more dark. They are called diazones, more dark areas here, and the longitudinal section areas, which are called parazones, will look more light. In this picture also, the lines which go from the dentin-enamel junction to the surface of enamel are the bands of Hunter-Schröger. Also in enamel we can see the lines of Retzius. Lines of Retzius are the evidence of the rhythmic growth of enamel. So they are growth lines. When the enamel is formed, the first formed layer is at the top of the cusp here. Next layer will be this one, next this one, etc. This is when our tooth has only one cusp. In teeth that have two or more cusps, each cusp will have its first part produced of enamel. So here you can see these lines, which are called Retzius lines. They represent actually the rhythmic growth of enamel, the layers of enamel produced one by one during amelogenesis. And these lines are seen in enamel here. This is how they look like in the longitudinal section of the tooth. And if we make the cross section, they will go around the pulp. So they look concentrically. They are located concentrically around the pulp. Actually, these lines represent hypomineralized areas of enamel. So these darker looking lines are more less mineralized than other light areas. So hypomineralized means lower than normal amount of minerals. Neonatal line represents the border between the enamel formed before and after birth, because the time when the baby is born, the birth time, it takes a baby up to 1 or 2 days to be born, and it is very hard period for a baby. So in this period the enamel production stops for a while, and then after birth continues, and this is marked with the so-called neonatal line. It is more thick dark line in this area here. Also in enamel we have other areas of hypermineralized enamel where the amount of minerals is lower than normal, and these are three: enamel lamellas, enamel tufts, and enamel spindles. Enamel spindles are the smallest between them. They are, as you remember, the tips of the processes of odontoblasts that are embedded inside the layer of enamel and look like the small ends embedded inside the enamel layer. Enamel tufts are larger. They look like the tuft of the grass, and the most long of them are enamel lamellae. They are long and thick, and they go through entire thickness of enamel, from enamel dentin junction to the surface of enamel. Here is the description of these areas. So enamel lamellae are thin sheets passing through entire thickness of the enamel. They are just areas of hypocalcified enamel, where ameloblast produced less amount of minerals than in other areas. Enamel tufts, which are seen here, look like grass. They are small branching conical structures, mostly near the border between enamel and the dentin. Enamel spindles are the smallest, and they are fusiform, non-branching tips of the odontoblast processes. Here you can see these structures in the cross section. So enamel spindles should be the smallest, tufts are larger, and lamellae go through the entire thickness of the enamel, from the dentin-enamel junction to the surface of enamel. All of these three are areas of hypermineralized enamel, which represent potential roads for infections to enter the tooth. This is why it is important to remember about them. The enamel is covered partially with the enamel cuticle, and enamel cuticle is worn out shortly after eruption of the tooth, except on interdental surfaces, on the lateral surfaces of the tooth. And enamel cuticle consists of two layers. The primary cuticle, or Nasmyth's membrane, it is the inner layer of the cuticle. It consists of layer of glycoproteins produced by ameloblasts before they died. So ameloblasts, which are seen here, they produced enamel, and then they produced thin layer of glycoproteins, and after this they died. And this layer of glycoproteins, Nasmyth membrane, is the inner layer of cuticle. And the outer layer of cuticle, or secondary cuticle, is the thick layer composed of the outer enamel epithelium and the stellate reticulum. So they come very close together in the area of the future cusp of the tooth, covering an enameloblast in this area, and together outer enamel epithelium and stellate reticulum will make the outer layer of cuticle. So this outer layer of cuticle, orange in this picture, is worn out in the most part of the crown, but still remains where the crown of the tooth is attached to the gingival epithelium. So it will be part of the connection area of the tooth with the epithelium covering the gum. And in mature tooth, the crown is covered with the so-called enamel pellicle. Enamel pellicle is the temporary thin film which consists of the precipitated glycoproteins from saliva. It is formed on the surface of the enamel, but it is very very fast destroyed during the brushing of the teeth, during mechanical cleaning. But after mechanical cleaning, it will be restored once again in several hours. It consists of glycoproteins from saliva, which cover the enamel of the tooth, and these glycoproteins represent the substrate, the food for bacteria. So very soon after the brushing of the teeth, we have this pellicle, and after it is colonized with bacteria. And bacteria form the biofilm above the pellicle, which is called dental plaque. Dental plaque is not very well seen thin film which covers the enamel, and if it is not brushed away, it will turn into the calculus or tartar, this darker looking area. So tartar is caused by the precipitation of minerals from saliva inside the dental plaque, and calculus cannot be removed with the brushing, so it is subject to the help of the dentist. The border between the enamel and dentin is called dentino-enamel junction. Here in this area, dentin is above, enamel is below. It is not smooth, not the smooth line, but is rather wavy, like this, and this increases strength of attachment of dentin to enamel. In this area, the crystals of hydroxyapatite from dentin and from enamel interpenetrate, means from dentin to enamel and backwards, and also some processes of odontoblasts come inside enamel and make enamel spindles here. So here you can see dentin above, enamel below, and the tips of odontoblast processes which make enamel spindles. Enamel in the area of dentin-enamel junction is the most permeable, and the dentin in this area is most sensitive. Dentin is the first mineralized component which is produced during development of the teeth. Dentin is produced by odontoblasts. Odontoblasts remain in mature tooth, but not inside dentin, but outside of it in the peripheral zone of the dental pulp. Only their processes, the processes of odontoblasts, are located inside the dentin, inside the dentinal tubules, which span from the border between the dentin and the pulp towards the surface of the dentin. So dentin contains dentinal tubules with the processes of odontoblasts inside, and extracellular matrix, inside which we have inorganic mineralized substances up to 70%. It is less mineralized than enamel, but more mineralized than bone and cementum. And 30% of organic substances, such as pre-collagen and collagen fibers of collagen type 1, also odontoblast processes, dentin-specific non-collagen calcium-binding proteins, and other proteins and other organic substances. The deposition of dentin by odontoblasts continues throughout the lifetime and increases if the tooth is damaged. So with age, the thickness of dentin increases, but the volume of the tooth chamber decreases. So here in this picture we can see the pulp. In the outer layer of the pulp we have the cell bodies of odontoblasts, and their processes go inside the dentinal tubules through the thickness of the dentin. Near the odontoblast we have the predentin, non-mineralized, and then mineralization happens. First the globules, balls named calcospheroids are formed, and then they grow and fuse together to form mineralized dentin. So here you can see the same odontoblast process, pre-dentin, with the collagen fibers, and here the mineralization front and mineralized dentin. So the first produced layer of dentin is at the cusp of the tooth, the tip of the crown, and then the process of production of dentin continues downwards, and the dentin of the root is produced later after the dentin of the crown. So here you can see odontoblasts with well-developed rough endoplasmic reticulum and Golgi apparatus to produce proteins. So dentin contains dentinal tubules with the processes of odontoblasts inside, and the space between the tubules is mineralized extracellular matrix. And in this mineralized extracellular matrix we have the so-called intertubal dentin. It is all dentin between the tubules, and the peritubal dentin. It is the dentin which makes the wall of the tubule. Peritubal dentin, it is seen here. It is more mineralized than intertubular dentin. Here in the pictures below you can see the longitudinal section through the dentinal tubules and cross section in the area of the dentin. So peritubular dentin is more darkly stained, more violet stained. It makes the wall of the tubules. So inside we have the inner space of the dentinal tubule with the fluid and the process of the odontoblast. The same on the cross section, the more bluish violet peritubular dentin with the whole of the dentinal tubule inside. And all the dentin between the tubules is intertubular dentin. Inter means between. So it is between the tubules. It is more lightly stained and it is less mineralized. In the tubule we have the fluid, which is called the dentinal fluid, and this fluid surrounds the apical process of odontoblast, or the Toms fiber. Also in the lower part of the dentinal tubule, most closely to the pre-dentin and the pulp, so only in this area. Also inside the tubule we will have the nerve fiber, which grows into the first part of the tubule from the dental pulp, and some thin collagen fibrils also. At first, the diameter of the tubule is larger, and then the process of odontoblast, which is located inside the tubule, continues to make dentin around it, and this causes the increase in thickness of the peritubular dentin and decrease in diameter of the tubule, because the dentin is constantly produced. The innermost layer of peritubular dentin is called Neumann's sheath. It is the thin film of organic substance of glycosaminoglycans produced by the odontoblast process. Because peritubular dentin is more mineralized than intertubular dentin, it is more fast destroyed by the caries process during demineralization of dentin. So caries is caused by the bacteria which make the acidic environment. In the acidic environment, the crystals of hydroxyapatite are removed from the hard tissues of the tooth, and the organic material is exposed, and bacteria can eat the organic material. So the areas which contain more mineralized material are destroyed more fast because of acidic environment. Because of the dentinal tubules filled with the dentinal fluid within them, the dentin is very highly permeable and sensitive, especially if it is exposed, like it is shown here. So in this area it is covered with enamel, very hard tissue, but in this area, for some reasons, maybe in some pathological process, the surface of the dentin is exposed, and the dentinal tubules will represent very easy way for microorganisms to enter the pulp through the tubules, dentinal tubules. And also this fluid makes the dentin very sensitive because of the pressure of the fluid inside the tubules, so it pushes the tips of the nerves which are located around the processes of odontoblasts, and this causes pain feeling. In this picture you can see the mineralized dentin with a lot of tubules inside them. But in normal condition, this permeability of dentin provides diffusion of nutrients and ions from pulp towards enamel and causes remineralization of enamel, and also provides nutrients to the cementum, which covers dentin in the root region. The layers of dentin include pre-dentin, which surround which is located the most closely to the cell bodies of odontoblasts, so this layer is very close to the pulp. Then peripulpar or parapulpar or circumpulpar dentin. The name means that it surrounds the pulp, so it constitutes the main volume of the mineralized dentin and contains the tangential von Ebner's fibers, so they go parallel to the enamel dentin junction in this direction in peripulpar dentin. And the outermost layer of dentin is called mantle dentin. Here it is, and it contains radial von Korff's fibers, which go radially. The same in this picture. So here we have enamel, dentin-enamel junction with several enamel spindles. This will be mantle layer with radial fibers of concords, then peripalpar layer with tangential fibers, and predentin. Also, we have these four types of dentin. The primary dentin is formed during embryonic period. The secondary dentin, or regular or physiological dentin, forms after eruption of the tooth. So most of the dentin is formed before eruption, and the innermost layers will represent the secondary dentin, which continues to grow towards the center of the pulp chamber after eruption of the tooth in mature tooth during lifespan. Tertiary dentin, also called reparative or irregular or traumatic, is formed in response to various sorts of damage. So, if the enamel is broken by the caries process, for example, and bacteria can reach the surface of dentin with dentin tubules, then bacteria can very easily and very fast go through the dentinal tubules towards the pulp. And if they colonize the pulp, they will destroy the pulp. If they destroy the pulp, no more feeding, no more nutrients and oxygen to dentin and to enamel and to cementum, and it will cause the death of the tooth. So, to prevent the passage of bacteria from the surface of the tooth to the pulp, the dentin starts to make new portions of dentin, tertiary dentin, very fast towards the center of the pulp. So these darker areas are the portions of the tertiary dentin in this area. So this dentin is formed to prevent passage of bacteria from the surface of the tooth towards the pulp. And also we have the transparent or sclerotic dentin. It is shown here. It is caused by the excessive deposition of minerals, causing irreversible occlusion of dentinal tubules. It means that processes of odontoblasts inside the dentinal tubules start to produce lots of minerals, and the volume of the diameter of the dentinal tubule decreases very fast, and finally it closes, and the dentinal process becomes embedded inside the hard dentin and dies. So these closed dentinal tubules make the transparent or sclerotic dentin here. Dentin, like enamel, has the growth lines, which represent the rhythmic growth of dentin during the dentin development. So these lines are lines of Owen, lines of von Ebner, and neonatal line. So in this picture we see the incremental lines of von Ebner. So in this tooth that has two cusps, this was the first produced layer of dentin, here and here. This was the second, the third one, etc. And the lines between these layers represent the incremental lines for von Ebner. Dentin, like enamel, also has areas of hypomineralized dentin. Hypomineralized means lower than normal. And these areas are two: interglobular dentin, which is in the crown region, this area, which goes parallel to the border between the dentin and enamel. Just interglobular dentin, and the granular layer of tomes, almost the same as interglobular dentin, but in the region of the root of the crown. So this area goes parallel to the border between the dentin and cementum. Here we see how the interglobular dentin looks like. So this is the dentin, this is the dentin-enamel junction, and this is the enamel with enamel lamellae, tufts, and spindles. And these dark-looking areas are areas of interglobular dentin, the areas where extracellular matrix of dentin has lower than normal amount of minerals. So these dark areas. This is how it looks like in real histological preparation. This is the dentin-enamel junction. Enamel is above, dentin is below, and these large are areas of interglobular dentin, dark looking. Here we see how the granular layer of tomes looks like. In this part, in the left, we have dentin, and here we have cementum with cementocytes embedded in it. So this is the cellular cementum. This is the border between the cementum and the dentin, and in dentin, closely to the border with cementum, we have these dark areas of hypermineralized dentin. This is how it looks like in histological preparation. Dentin is on the left with visible dentinal tubules, and cementum is on the right with cementocytes seen here, and this is the area of granular layer of tomes. The dark areas are the areas of hypermineralized dentin. Next, dental pulp. Dental pulp is loose fibrous connective tissue with a lot of blood vessels and nerves. It fills the pulp chamber in the crown and the dental canal in roots. And so, according to its location, it is subdivided into the coronal in the crown and the radicular in the root pulp. And the pulp chamber repeats the general shape of the tooth. So if our tooth has only one cusp, so the same will be the shape of the pulpar chamber in this case. And if our tooth has two cusps, so our pulp will have such shape with two horns. So these areas are called horns. The blood vessels and nerves enter the pulp through the tip or apex of the root, which is called apical foramen. And the number of apical foramens is the same as the number of root channels. And so because dentin is secreted throughout life, the volume of dentin increases and the volume of pulp decreases with age. Histologically, in the pulp we have three layers. In the picture on the right, we have the border between the dentin, more darkly red looking predentin, more light area here. Here is the border between the dentin and the pulp, and everything below this border is the pulp. So, in the pulp we have three areas. Outermost area is called peripheral or odontoblastic layer. It contains cell bodies of odontoblasts, which can lie in one or several layers. So it can contain from 1 to 8 layers of cell bodies of odontoblasts, and also some blood capillaries and nerves fibers, which enter the dentinal tubules in the first part of the dentinal tubules. Next goes the second intermediate layer. It is also called subodontoblastic layer because it is located below the layer of odontoblasts. And in intermediate layer we have two subzones. The outer cell-free zone, more lightly looking here, it is also called the basal layer of Weil. It contains almost no cell bodies, of cells, so this is why it is called cell-free zone. It contains extracellular matrix of loose fibrous connective tissue, fibers and processes of the cells of the inner layer, and also some blood capillaries and nerve fibers. The inner layer is called inner cell-rich zone because it is rich of the cell bodies of different cells, and this sublayer contains the pre-odontoblasts, kind of stem cells for odontoblasts, and also other cells of loose fibrous connective tissue, and also blood capillaries and nerve fibers. And next below goes most of the volume of the pulp, which is called the core of the pulp. It is the general loose fibrous connective tissue with a lot of different cell types, most of which are fibroblasts, some fibrocytes, macrophages, etc. Thin collagen fibers, almost no elastic fibers because no elasticity is needed inside the hard tooth, and a lot of blood vessels and nerve bundles. The same we can see here. So this is the dentin, pre-dentin with some chalcospheroids seen here, the border between the dentin and the pulp here. Next, peripheral odontoblastic layer of the pulp. It contains cell bodies of odontoblasts and also nerve fibers which go between odontoblasts and enter the proximal parts of the dentinal tubules. Also some loops of capillaries come here in this layer. Next goes the outer cell-free zone of intermediate layer. It is cell-free because it contains no cells, only fibers, nerve fibers, and blood capillaries. Then goes inner cell-rich zone with a lot of cells here, including pre-odontoblasts, and then below goes the core of the pulp. The pulp in the pulp chamber and the root canal, which are called coronal pulp and radicular pulp, differ in histological terms. So coronal pulp has loose fibrous connective tissue with very high amount of cells of different cell types. Also, it contains several layers of odontoblasts in the peripheral layer, and it has a very high amount of small blood vessels, blood capillaries, and nerves. The radicular pulp, the pulp in the root canal, has almost dense fibrous irregular connective tissue. So the connective tissue here has so much amount of bundles of collagen fibers, so it is almost dense, fibrous irregular connective tissue with very few fibroblasts and fibrocytes and thick bundles of collagen fibers. In radicular pulp, the intermediate layer is missing, so no outer and inner zone we will see here, and no pre-odontoblasts. And very small amount of odontoblasts in this area, only 1-2 layers of cell bodies. Also, the amount of blood vessels is lower than in the coronal pulp, but here in radicular pulp, the blood vessels are larger, and nerves form nerves bundles. The changes in the dental pulp during aging and some pathological conditions include the decrease in the volume of the chamber, also decreases the number of cells in loose connective tissue, volume and number of collagen fibers increases, and also some calcified structures start to be found inside the dentin, which are called petrification areas and the denticles or pulp stones. Petrification areas are the diffuse areas of calcification, mostly found in dental roots, along the nerve fibers and blood vessels, and also in the walls of blood vessels. So these are areas of the calcification of loose connective tissue because of deposition of excessive amounts of ions, which start to form crystals. Denticles or pulp stones are round or some irregularly shaped calcified bodies, and they are classified according to their localization into the free denticles, which are found inside the pulp and not attached to the dentin. The parietal or attached denticles, they are inside the pulp but attached to the dentin. And the interstitial denticles. Interstitial denticles are located within the layer of dentin. Denticles may compress, may squeeze blood vessels and nerves and so cause pain. And also they make the work of dentist harder if they are present, because they can feel almost all the pulpal chamber, or they can block the root canal if they are present. By origin and structure, denticles are subdivided into true denticles and false denticles. True denticles are produced by odontoblasts and look like small pieces of dentin with the dentinal tubules and processes of odontoblasts inside them. False denticles are concentric layers, lamellae, of calcified material, and usually they are surrounded with dead cells, and they contain no dentinal tubules, but still they are calcified rounded bodies. In this picture we can see the section of the tooth. In the center area we have the dental pulp with the odontoblast layer here and the core layer here, and the dentin. More lighter area is the predentin, and here mineralized dentin. At high magnification, what we can see here, cell bodies of odontoblasts, predentin, and dentin with dentinal tubules. Dentinal tubules are surrounded with more darkly looking peritubular dentin. And in this inset we have the cross sections of the dentinal tubules. Next, cementum. Cementum is the hard dental tissue, but it is softer than enamel and softer than the dentin. It consists of only 50 to 60% of minerals, including phosphates and carbonates of calcium, which make hydroxyapatite crystals, and a lot of organic substance, up to 30–40%. The dentin covers the cementum covers the dentin in the root region, and in this picture you can see the types of the border between enamel and cementum. In some cases, the enamel just meets the cementum in the neck region. In some cases, the cementum and enamel overlap in this region, and in some cases, enamel and cementum are separated with the free zone of non-covered dentin. This case is the worst between them all, because here we have the zone of exposed dentin. It is very bad for tooth. In structure we have the primary or acellular dentin. It covers entire surface of the root. It is produced first. This is why it is called primary. Secondary or cellular cementum covers the acellular cementum from outside in the apical 1/3 of the tooth root in this area, and in the bifurcation area of multi-rooted teeth So here in this area between the two roots. In this picture we can see the structure of dentin. During cementogenesis, primary cementum is formed first, and in the tips of the roots and between roots, after primary, the secondary cementum is formed. And here in this picture we see the border between the dentin and cementum. So here will be the pulp with the odontoblast cell bodies, dentin with dentinal tubules. This is the acellular cementum, here cellular cementum, and here periodontal ligament. This area is shown kind of at high magnification. So here is the acellular cementum. It was produced first by cementoblasts. Then the cellular cementum was produced, and some cementoblasts became embedded inside this layer and became cementocytes. They are located inside the lacunae, and their processes go inside canaliculi, small channels, like it is in the bone tissue, because cementum is actually the type of the bone tissue. And some of cementoblasts still lie upon the surface of the cementum. Here you can see the periodontal ligament. It consists of bundles of collagen fibers, and some of these fibers are embedded with one end inside the cementum. Their second end will be embedded inside the bone of the alveolus. And these are Sharpey's fibers shown in this real histological picture here. So this is the electron microscopy picture showing cementum in this area and the Sharpey's fibers, with one end of which embedded inside cementum. With age, or in some pathological conditions, or during insufficient development of the root of the tooth, we can find the so-called cementicles inside the cementum or periodontal ligament. Cementicles are rounded calcified bodies which can be embedded inside the cementum or attached to the cementum, or lying free inside the periodontal ligament. Cementicles are formed by ectopic cementoblasts. Ectopic means those which did not take their normal place. So they start to develop in some not normal area. So these not normally located cementoblasts start to make the cementum around the core, some first particle, and this first particle can be the rest of Malassez. As you remember, rests of Malassez are not fully disintegrated hairs, Hertwig's epithelial root sheets during development of the root. So if we have rests of Malassez, they can make finally the cementicles. In this picture we see the cementum, dentin here, next cementum, next periodontal ligament, and the alveolar bone. And three types of cementicles, this classification based upon their location. So we have interstitial or embedded inside the cementum cementicles, parietal or attached to the cementum cementicle, and the free cementicle, which is located inside the periodontal ligament. In this picture we see the free cementicle located inside the periodontal ligament. Supporting tissues of the teeth provide attachment, fixation of the tooth into the alveolar bone, support of the tooth, bone remodeling during the movement of a tooth, proprioception, the sensitivity, and they help in the tooth eruption. And these supporting tissues include alveolar bone of the alveolar process of maxilla and mandible, periodontal ligament, and gingiva. Gingiva will be discussed in the next topic. The periodontal ligament is composed of dense fibrous connective tissue, 70%, and loose fibrous connective tissue. And periodontal ligament serves to attach the cementum of the tooth to the alveolar bone. Because the production of periodontal ligament is associated with the production of collagen fibers. For production of collagen fibers, we need a lot of vitamin C, ascorbic acid, and it means that in the absence of vitamin C, in the lack of vitamin C, we will not have the normal periodontal ligament, and it will cause the tooth falling out. In this picture, we see different types of collagen bundles inside the periodontal ligament. So periodontal ligament contains collagen fibers which go in different directions and attach different parts of tooth to the surrounding tissues. So here we have horizontal fibers. They go horizontally like this, and they are located in the upper part of the tooth. They connect the upper part of the cementum to the alveolar bone. So these are the horizontal fibers. The most of the fibers of periodontal ligament go oblique like this, and so they are called oblique fibers. Here and here and here they are. At the tips of the roots we have the apical fibers. So they attach the tip of the root, its apex, to the alveolar bone, apical fibers. Now, between the teeth we have the so-called alveolar crest, the evagination, the protrusion of the alveolar bone here, and in this area we will have the alveolar crest fibers, which connect the cementum of the tooth to this alveolar crest. And also between the adjacent teeth we can have the transseptal fibers, which attach the cementum of adjacent teeth together. Some clinical consideration. Here the process of the caries is shown. So it starts with the colonization of the pellicle with bacteria. Bacteria produce acids. Acids destroy calcified mineralized part of the enamel. Then we will have the hole in enamel, and then the process of disruption of dentin starts. Bacteria can pass through the dentinal tubules towards the pulp. To prevent this passage, the dentin will form here the tertiary dentin. Some age-related changes in teeth described in words in this slide and in pictures in this one. I will explain in this one. So, what happens during aging? Number one, abrasion of enamel. So in young teeth, the surface of enamel is like this, and abrasion causes more smooth surface of enamel, because some enamel is abrased, broken down, and erased during chewing. Next, dentin thickness increases. If we compare it here and here, dentin thickness increases, and so dental pulp volume decreases. Was like this, number 3, and became like this. Next, cementum thickness increases. Cementum thickness increases. Next, parodontum remodeling happens, and it causes the passive tooth eruption. So the cementum grows in this part, the black area here, and it causes the passive tooth eruption. It means that tooth is pushed upwards, and now the clinical crown increases. It means that in young age the neck of the tooth where enamel meets cementum was hidden inside the gingiva, so it was in this part. But after tooth eruption, the area where enamel meets cementum became visible. It is now above the area of the gingiva. And because cementum is less hard, it is much softer than enamel, and it is much more permeable, and it has living cells, so it is the easier way for microorganisms to come into the tooth. So, this is all. Thank you for your attention. Have a good day.